Bismillahirrahmanirrahim. Today we are going to discuss about radioiodine ablation of the thyroid. So in this video I'm going to tell you need to think 100 times before thyroid radioiodine ablation or thyroidectomy. First of all, we all should know it is not a cure. Rather, you are shifting from antithyroid medications to thyroxine for rest of your life. So it's just a change in medication. Why is that so? It is because if you are having these three antibodies in your body, that is TPO antibody, also known as thyroid peroxidase antibody, TSHR antibodies, and thyroglobulin antibodies. These are the antibodies which are making your thyroid work abnormal in Hashimoto's thyroiditis as well as in Graves' thyroiditis. Then you are going to suffer more after radioiodine. Just because of these antibodies, if you go for radioiodine ablation or a thyroidectomy, you will suffer more after the treatment, because even with the removal of thyroid will not make your life easy, and your thyroxine that you will be taking for rest of your life won't be as good functionally as in a patient who has no antibodies like these in his body, because all these three antibodies cause inflammation in the body, and hence your thyroxine level, that is the T3, will always be low. Radioiodine won't kill the lymph nodes, just because the radioiodine ablation causes destruction of the thyroid, not the lymph nodes. And permanent antibodies will be produced. It is a phenomena in the body when you remove the main source that is causing the antigen. If you remove it by destroying with a radioiodine or removal of that thyroid, the antibodies will be produced more by the lymph nodes that are present in the near vicinity of that thyroid. Thyroxine with normal TSH that you will be taking after radioiodine and thyroidectomy won't make you the person you used to be. This is the thing which most of the population in the world is suffering from. They are taking thyroxine, synthyroid, leothyronine, but still they are not like they used to be because of these three antibodies. These three antibodies are so they increase after radioiodine ablation or thyroidectomy, and they hence cause more and more inflammation in the body. So the actual problem after radioiodine or thyroidectomy is immunoendo problem. And the real problem that is actually present behind the Hashimoto's thyroiditis and Graves' thyroiditis is the energy factory of the body, that is the mitochondria. So if you nourish this mitochondria, your antibodies will decrease and your self-producing thyroxine will increase. That is the T3, and you will feel much better with no immunity, and you don't have to go for that radioiodine ablation and thyroidectomy, which is the worst treatment for a patient with thyroid problems. The key is to nourish the mitochondria, and the symptoms of hyperthyroidism and hypothyroidism will go away. So how do you treat it? It's very simple. You need a lot more iron, selenium, magnesium, CoQ10 and zinc. These are the minerals that are used for the cycle that produces the energy in the mitochondria. So stay tuned for my next video about the dosage of these iron minerals and more details. So if you like this video, do like, subscribe and share this video. Thank you.